Welcome to the weekly checkup on ReachMD for the week of February 15th, 2016. This week's news report comes with a warning to nature lovers. Researchers from the CDC and Mayo Clinic have unearthed a new species of bacteria that causes Lyme disease. The bacteria was discovered after 6 people with suspected Lyme disease received unusual test results. Further genetic studies led to the discovery of the bacterial species that has since been dubbed Borrelia mayonnae, in honor of the Mayo Clinic researchers who assisted with the discovery. The new bacteria causes slightly different symptoms during the infection, including acute nausea, vomiting, and diffuse rashes instead of the bullseye rash associated with the classical Lyme disease presentation. Experts believe the bacteria is presently confined to the upper Midwest of the United States, but clinicians in other regions should still be aware of this development for encountering patients with unusual symptoms for Lyme disease. To learn more about this and similar topics, head to ReachMD.com. ReachMD continues its editorial focus on heart health this week in the segment, Integrating Online Heart Disease Risk Assessments into Practice. Hear from the CEO of Midwest Heart Specialists as he discusses the potential applications of this technology. And now, for a quick look at some of our latest featured content. If you're still looking for a New Year's resolution, our latest Primary Care Today segment may give you some inspiration to get up off of the couch. Join host Dr. Brian McDonough as he outlines the startling findings related to sedentary habits and sporadic exercise. To learn more, check out the segment, A Crisis in Slow Motion: Why the Rise of Sedentary Lifestyles Matters. In this week's featured video, hear how your choice of words can instill confidence in your patients. Coming up in this episode of Speaking Of with Karen Friedman.
Imagine if you're a patient about to receive some unpleasant news. The doctor walks in and says, "I think this is a temporary setback," or "I believe you'll be okay." While these statements may be true, saying "I think this is a temporary setback" is not as strong as "I'm optimistic this is only a temporary setback." Just as "I believe you'll be okay" is not as reassuring as "I'm confident you'll be okay." When we use weak words, not only do we signal that we're not sure of ourselves, but sometimes we may send mixed signals to our listeners as well. Here are 3 ways you can use words to instill confidence in patients and others. Speak simply. Use plain words as if you were talking to a neighbor or to a friend. Next, words like "I understand" or "I realize this is difficult for you" tells the patient that you're empathetic and you care about their well-being. 3, if you're running very late and you've kept someone waiting, take a moment to apologize or offer why you're behind so they understand that you value their time as much as your own. When you speak confidently, you instill confidence in others. For ReachMD, I'm Karen Friedman.
For more featured content, head to ReachMD.com or listen in on any of our recommended platforms. Thanks for joining us today. I'm Marshall Miller, as always, inviting you to be part of the knowledge.